The folks that we serve are often so marginalized. People do forget that they are fathers and brothers and sisters.
This place changed my life. I'm so grateful to you guys.
How long have you been here?
I've been here.
No one chooses suffering.
He really embodies our mission.
He's just a person who does absolutely everything. There's nothing that he doesn't do or thinks he's above.
When he's around, you just feel better.
Thank you. Appreciate your stuff.
I'm just blown away by the way Barry does his thing.
We really are a health system for individuals experiencing homelessness. We have a flagship site right on the Roxbury South End border, but we also have 30 sites within family and adult emergency transitional shelters. Barry is our Chief Executive Officer, and he's phenomenal. He's been in our program for more than 30 years. He started as a nurse in our program.
Most of our program is based on what we learned from the nurses, and doctors like me needed a lot of learning. Barry's got a clear vision. He doesn't get discouraged by failure. In fact, he's animated by failure, and he took every failure we had and found the opportunities in it.
He really was such a force in Boston in getting the country's first medical respite program established.
Even just, an ACL repair or cataract surgery, where do you go if you're experiencing homelessness? Do you then recover in a shelter? That's a pretty awful environment. Hospitals don't want to keep you. Same is true for end-of-life care.
It's such a niche level of care for people without homes who are sick that Barry has had a huge hand in shaping. He was part of the first group that got together nationally to advocate to Medicare, Medicaid, HRSA, that medical respite was something that we needed support for, and that work continues today as part of the National Healthcare for the Homeless Council's Medical Respite Institute.
Because we are quite a vibrant program, there were many occasions where I would be just walking through our lobby and responding to an overdose.
Drop everything, stop clinic, respond to someone who's not breathing.
Sometimes that was as much as 7 times a day.
The idea behind SPOT was something that we had been talking about for several months.
We would resuscitate someone only to have that person then refuse to go to the hospital. We were really terrified that folks would walk out of our building only to then overdose again, but this time not in a way that's being monitored.
Barry basically said, we are going to figure out how to do this. We're going to support this idea as a program, even though it's so provocative.
She was trying to find a way that provided both dignity as well as oversight.
We opened a room for people who were actively intoxicated and said, you know what, we want you here. It's okay. In any state that you're in, we want you to come in. We want to just take care of you in the moment. We want to make sure that you don't die from use of this substance. And we're going to make sure you know that we care about you. We love you. You have worth. And that this is a healthcare setting where we're not going to stigmatize active addiction.
There's a lot of hostility. There's a lot of blame that gets directed at the people that we serve.
When I came here, I felt like a human being. I felt like someone cared about me, that they would introduce me by saying, "Hi, Derek." And that just kind of blew me away, and it opened up the door for me to allow the medical team to get to know who I am.
The thing that I'm frankly proudest of in my entire career is the creation of our Consumer Advisory Board. Our Consumer Board has been the model for all 350 across the country.
If there's some ideas that I have, I can present that to the Board of Directors. I am a Consumer Advisory Board member here, and I'm also been on the Board of Directors. My role for me personally is to make sure that people that are coming through the doors after me are getting the same quality care that I receive. Barry comes to every meeting.
He leads by motivating people, not by pushing them or pulling them or tugging them. He just gets people to embrace the vision, and that, I think, is a sign of a really brilliant leader.
You have this sense that he's in it with you, and that really matters when the frontline work you're doing is really hard.
I did get invited to Barry's wedding, and I just saw Barry cut up, get his dance on, drink a little wine. And I seen other staff members do that, and it was just like, okay, these folks are real. They're human beings just like me, okay.